Good morning, good afternoon, and good evening. I'm Maria Guadalupe Garcia Darderes, pharmacist, and I'm happy to facilitate the following conference from European region. Thank you to all of you to be here today. On behalf of the International Society of Pharmacovigilance, we're very pleased to welcome to all of you on the third edition of the ISoP Patient Safety Day event that will be held in 2 days, September 7th and tomorrow, September 8th. The World Health Organization established the Patient Safety Day to increase public engagement in healthcare safety and promote global actions to prevent and reduce avoidable harm in healthcare. This year, WHO is promoting medication without harm. ISoP reaffirms the objectives of the WHO Global Patient Safety Challenge and call on stakeholders and health professionals to prioritize and take early actions in key areas associated with significant patient harm due to unsafe medication practices. These include high-risk situations, transition of cares, polypharmacy, look-alike, zone-alike medications, and other serious disruptions in the provision of health services. Starting with our President, Mary Harrison, will address a few words to all of you. Please listen to her. Thank you for your attention. Now, I want to invite you to show your participation in social media using the following hashtag. Hashtag ISoPOnline PSD22, ISoP Medication Safety, ISoP MEDER, ISoP Medication Without Harm, ISoP World Patient Safety Day, and publishing your pictures or ideas about medication topics without harm. Following with the program, let me introduce Dr. Santiago Schiaffino. He's head of PV System and Standard and Deputy QPPB at Boehringer Ingelheim, and he's presented his conference named Medication Error and Effective Communications. So we invite you to participate actively on the session and put all your questions on the chat, and we'll be pleased to respond all of you during the session or later in our page. Without further, please give a warm welcome to our conferencist. Thank you, Santiago. You are welcome to be here.
Thank you, Guadalupe. Good morning, good afternoon, everyone. So let me share my screen quickly, and I will start with the presentation. Okay, as Guadalupe already introduced, the title of my presentation is Medication Error and Effective Communications. So quickly, you will see no mueve las slides. Good morning, good afternoon, everyone. So as Guadalupe already anticipated, the title of my presentation is Medication Error and Effective Communication. So this is the disclaimer. So I am a full-time employee of BI International GmbH. I will start with a little introduction for the topic. And the first thing that I want to share with you, as most of you already know, unsafe medication practice and medication error are a leading cause of injury and avoidable harm in healthcare systems. Patient safety should be a priority for all of us in modern healthcare systems. Considering the huge burden of medication-related harm, medication safety has been selected as the theme for World Patient Safety Day during 2022. A lot of population-based studies have constantly shown excessive high rates of medication error and avoidable deaths. Experts urge to embrace an attitude of shared responsibility, creating a supporting environment in where everyone can openly express any safety concern. And a change in patient safety culture toward reported adverse drug reaction or medical errors is really needed. Engaging and empowering patients and families, for particularly following WHO initiative 5 Moments for Medication Safety, is a must. Here you could see the WHO Global Patient Safety Challenge, Medication Without Harm, and this challenge launched in March 2017 was a global initiative to reduce severe and avoidable medication-associated harm worldwide by 50% over the next 5 years, and the main scope is to address the weakness that lead to medication errors. In such way, we will improve the way how medicines are prescribed, distributed, and consumed. Also, we will increase the awareness among patients about any inherent risk associated with improper use of medication. This challenge is focused in four main areas: patient and the public, healthcare provider, medicines, and system and practice of medication. This is the campaign that is called 5 Moments for Medication Safety. And in these 5 key moments is where any action conducted by patient or caregiver can reduce the risk of harm associated with the use of medications. These moments include 5 critical questions. Some of them are self-reflective. Others will require the support and discussion from healthcare provider to be answered and reflected upon. So the 5 key moments are starting a medication, taking the medication, adding a medication, reviewing my medication, and finally stopping my medication. To continue with some general background about the medication error and communications, I would like to point out that patients might receive and usually receive care from different facilities and multiple healthcare providers. This includes specialists from several disciplines. Every point in the care process contains some inherent risk, and medication error could result from problems in practice, procedure, or system inherent to this risk. As you may already know, medication errors may occur both in inpatient and outpatient settings, and one of the major causes of medication error is ineffective communication. The crucial first step for preventing medication error is that all of us have a full commitment to adopt a culture of patient safety. On the 20th anniversary of To Err of Human, executive emphasized the value of creating a workforce in which medication error and near misses can be openly discussed. It is really known that all the organizations need to proactively design and implement strategies to identify high-risk situations related to medication use and build a robust system that intercepts them before they could result in patient harm. So now I want to discuss and review with you what is really a medication error. We know that there is not a standard definition, and we have more than 30 definitions currently, and this definition vary widely in the scientific literature. So I will put 2 of them. So the one is the classic definition from the National Coordination Council for Medication Error Reporting and Prevention. And the other one that is more pragmatic from my point of view is the one from the Good Practice Guide on Recording, Coding, Reporting, and Assessment of Medication Error from EMA, that defines medication error as any unintended failure in the drug treatment process that leads to or has the potential to lead to harm to the patient. So in all the slides, you will have the links where to find the complete information. EMA also categorized medication error in 4, and these 4 main categories are wrong medication, wrong dose, wrong route of administration, and wrong patient. So I put here some real examples for medication errors, and usually most of the traditional one is the confusion with the trade name during drug delivery, confusion between capsules at home due to similarity, that patients remove capsules from original blisters and store them in a pill dispenser, even when there is a contraindication or the SMPC recommends not to do so. Also, when there is a prescription with a dose that is higher that is recommended in the SMPC. Also, incorrect route of administration, for example, the injection of an oral medication solution. During the prescription, that healthcare professional could be distracted and confused writing one medication when want to prescribe another one. Also, something really common is to writing eligible, so another medication is dispensed instead of the current one. Some numbers about medication error. So approximately 6 to 7% of hospital admissions appears to be medication related, and 2/3 of these are due to medication error. Due to that, 1 to 2% of patients could be harmed as a result. Up to 80% of this harm is preventable, and this is why we are here today. Finally, this could ensure approximately 1.3 million people annually, and the cost associated with medication error has been estimated at $42 billion annually, representing almost 1% of total global health expenditure. To continue, when medication error can occur, this could happen at any stage from prescription until administration. And these are the four, in these 4 boxes, you could see which are some of the costs. For example, that could be knowledge-based, rule-based, action-based, or memory-based. In order to prevent medication error, we need to know that each medication error might be different and has an individual root cause, and we need to understand and analyze this root cause in order to be able to implement any preventive actions. And for that, we need to have a system in place to collect and study medication errors. So this is something that you perhaps already hear about in order to prevent medication error, is to follow the 5 rights of medication administration, in where you need to check if you have the right drug, the right dose, the right route, and the right time and the right patients. With following this rule, you could avoid a really big percentage of medication errors. Some strategies to prevent medication errors. So as you could see in this slide, there are a lot. Some are related to automatization of the process, electronic prescriptions, barcode, training, system check. So we have a lot in place, but the main objective of my discussion today is to go deeply on this one, that is improve communication. In order to prevent medication error, we have several key players, and in the screen you could see health authority, healthcare professionals, pharmaceutical industry, and of course also caregivers and patients. Starting with the health authorities, both EMA and FDA had really nice and useful guidelines to prevent medication errors and to handle this. And you have the links below. So on the left, you could see that it's important for EMA that the report of medication errors and all interventions are deeply evaluated in order to take any corrective and preventive actions in order to avoid the recurrence. FDA, also similar to EMA, has some guidelines in order to reduce medication errors. And for that, before any drug is approved by FDA, FDA reviewed the drug name, labeling, packaging, and also the product design to identify and revise information that may lead or contribute to medication error. So it is checked that the proposed proprietary name, so the trade name, to minimize the confusion among existing drug names. Also that the containers labeled to help healthcare professionals and consumers to select the right drug product, and also review the prescribing and patient information to ensure that the directions for prescribing, preparing, and finally to use are clear and easy to read. So how could medication error be prevented? Here you see 5 critical steps during the medication process. So I will focus today in the communication and patient engagement. So we know that when the use of medication is not adequately communicated, either for the healthcare professional or for the patient, this could lead to a medication error. So now we have a background about what is medication error. Now I want to give some tips about what is considered to be an effective communication. A true communication is a message which has been sent with evidence that it has been received, understood, and has prompted appropriate actions. And the main principles of effective communication is to be clear about your purpose, know your audience, so it's empathy here, choose appropriate method for doing the communication, present the message attractively, make the benefit clear, and repeat the message and seek feedback. The principle of effective communication include these 5 C's rules, so that the information is complete, because the receiver of information decide always to receive the complete information, that the information is concise, so it's a prerequisite to effective communication, that the information is concise enough, and irrelevant and unnecessary repetition should be avoided. Also, the communication should be concrete, clear, and courtesy. Choosing the best mechanism to deliver the message is to ensure that the recipient fully understands the content that wants to be transmitted. Problems arise when the information is incomplete, incorrect, or obsolete. And in order to overcome obstacles to good communication, these include advocating, active listening, writing message for a specific audience, and using visuals sometimes to enhance writing words. If the patient knew the correct name of the medication, always have the correct medication on hand. Some key facts regarding communication and medication errors is that to have an effective communication is imperative in reduced medication errors. Communication failures are the leading cause of inadvertent patient harm. We know that the care, there is a huge complexity of the care process that can make communication and teamwork paramount in the delivery of healthcare services. Poor communication poses a high risk to patient safety and occur at every level in the healthcare delivery setting. We know that there are several publications highlighting the negative impact of poor communication in the patient safety healthcare setting, and also that major communication issues in healthcare environment include language barriers, medium of communication, physical setting, and social setting. Patients need knowledge and need support in order to be able and to be motivated to undergo medicine therapy. There is a real need to design strategies of effective communication and teamwork according to healthcare providers, and this could influence positively in the quality of healthcare service and finally patient outcomes. To continue with some key facts, so we know that the effective transfer of information requires solid foundation in communication skills, and that these good communication skills have many positive effects on health outcome and patient satisfaction. Also, that healthcare providers, we tend to use technical language because we consider that this tone is always the professional one. But if healthcare professionals speak only a common medical language, much can be lost in the transfer of information. So we should avoid to use technical expression and only use well-known abbreviations for the patient. Use verbal and written communication is preferable because this combination provides multiple channels for the information to be exchanged. Also, the setting where we are conducting this communication should be reasonably quiet, and the usage of a visual aid may improve the accuracy of patient reports. The major communication error is to assume that the communication has taken place and got through effectively. Communication between patient and healthcare providers should be always simple and clear, because we need to assume the responsibility to communicate according to the patient health literacy. And we will discuss about what this means in a few slides. Presence of a physical communication problem was significantly associated with increased risk of experience any preventable adverse event. Language barriers and patient disabilities that affect communication have been shown to decrease quality of care, and we should also have this in mind. Patients with communication problems were 3 times more likely to experience a prevent adverse event than patient without such problems, 3 times more. So in order to reduce medication error, some strategies has been proposed. The first one that I want to highlight today is the healthcare provided communication training. Why? Because we know that the foundation of a high quality and patient-centered care approach becomes imperative. Healthcare professional patient communication regarding medication use is a fundamental aspect of healthcare. We should have a considerable effort and we should dedicate courses to improve communication skills for all healthcare providers. Communication skill training has proved a positive influence in enhancing communication proficiency to patients. Also, we should seek for the implementation of standardized communication techniques. Also, something that we don't need to forget is that the efficient interdisciplinary communication is a vital requirement for quality healthcare delivery. And healthcare providers should not only focus on effective communication courses, but also attend training on cultural competence and diversity. To continue with another strategy to reduce medication error is to involve and educate patients as much as possible. We know that 50% of the caregiver helps with the medication for the patients, and 65% of caregivers are communicating directly with healthcare provider. Caregivers are an integral part of the patient care team, and we need to educate and engage with them by clearly communication any information about the patient medication, including specific administration instruction and any potential adverse drug reaction. We always should assess patient and caregiver learning preference. Patients are different. We know that individuals have different learning styles, where some prefer to learn through visual diagrams and pictures, others prefer to listen to lectures, perform hand-on activities, or even read writing brochures. This is part of a bigger picture that is called health literacy, and is also an important element in effective education, both caregiver and patients. It's not enough that people simply understand information. They must be able to use it, to read it again, to analyze and to check if the understanding is correct. Healthcare providers should also understand that the patient's sociocultural background may influence in their perspective, values, belief, and also behaviors regarding health and well-being. And using medication is a really big part of this. The ability to communicate effectively with patient and caregiver from different social cultural background is at the center of a cross-cultural care. To continue with the patient and caregiver strategy, we know that during healthcare provided patient interaction, 3 cultures are involved: the one from the patient, the one from the healthcare provider, and finally the culture of the medicine. And this culture could diverge and create communication difficulties. By remaining open and not judgmental with social and contextual factors, this influence and avoid that any patient could interpret the message different. We need to develop partnership with patients and caregivers who are culturally different. Healthcare professional can engage patient and caregiver utilizing the teach-back method, and this is a method based on health literacy to ensure that the information has been provided in a way that patient and caregiver really understand. So using this method, a healthcare professional uses plain language in a clear tone at the modern pace to deliver the most important message with a summary of 2 to 4 additional key points. Afterwards, it's important that after providing the educational information, healthcare providers should use non-shaming, open-ended questions to assess their understanding. Classic example is saying the following: Just to be safe, want to make sure we are at the same page. Could you tell me? The patient and caregiver are thereby asked to explain in their own words what they have just learned. If they are not able to teach back correctly, healthcare providers should rephrase the message until the patient or caregiver demonstrate clear understanding. By improving communication and understanding, this teach-back method has been positively correlated with improved adherence and outcome for patients. Also, another strategy to reduce medication error is the use of a medication list. What is a medication list? It's a complete, accurate, and current list that is a critical tool for identifying medication management issues. So this list is complete after a stepwise medication reconciliation, and this could reduce and prevent medication error for all kinds. This reconciliation with the medication list should occur at each visit, providing to the patient an accurate list, including all of their medication and their strength, frequency of dose, and also the direction of use. Healthcare providers should also assess for any inappropriate prescribing, for example, a pill burden and the regimen complexity for the patients. This reconciliation also allows providers to review potential drug-drug or drug-disease interaction, which is one of these more used strategies for the medication list, is called the brown bag method. And this is a form of medication reconciliation, especially used in primary care. So with this, the healthcare provider encourages to patient or caregiver to bring all prescription and non-prescription medication to each visit for review. Doing so, healthcare provider can assess medication understanding. For example, what are you taking for this medication? When are you taking? How much you take of each time for this medication? Also could ask any concern or question that the patient might have with this medication, could clarify any instruction for the correct medication use, and also identify or avoid any medication error and potential drug-drug interaction. This brown bag has shown that these improved patient understanding and adherence can be achieved by providing both written and also verbal instruction following each encounter and review. Administering medication at consistent times and providing the exact amount required for each dose might also increase adherence and decrease misunderstanding or errors. Other important step to prevent medication errors is during what is called the transition of patient care. What is the transition of patient care? Is transferring a patient from one care setting, for example, hospital, nursing facility, primary care, to another, for example, going home. And this is called transition of care by the Center for Medicare and Medicaid Services. And healthcare provider could decrease the risk of medication error by improving the effectiveness of transition patients between healthcare settings. Hospital discharge are one of the most frequent examples of transition of care. Randomized clinical trial found that more than half of the patient discharged experience a clinically important medication error within 30 days of discharge. So this is a huge burden of health. And this could estimate about the cost of estimate readmissions is $50 to $20 billion annually, just in the United States. Many factors contribute to ineffective transition of care, and root cause often differ from one healthcare organization to another, but all of them include breakdowns in communication. So for this, the Joint Commission Center for Transforming Healthcare report that these communication breakdowns occur when healthcare providers do not effectively communicate among themselves, so between the healthcare provider to the patient or to those that are taking care for the patients. Risk factors include conflicting expectations between the providers, cultural difference, as we already pointed out, inadequate time. We know that sometimes this transition of care is being done really quick, and the patient or caregiver doesn't have any time for any question. And also that a lot of institutes lack of standard operational procedures, so they don't have any checklists, surveys, or any specific form to check that this process was done correctly. Patients may also find the medication regimen really confused or complicated, especially if are not clear instructions provided by the healthcare provider. To improve the outcomes and decrease finally adverse drug reaction and medication errors, reduce readmission, evidence-based model for transition of care have been developed. Although each model may differ between the institutions, all of them support conducting effective healthcare provider communication. And this could mean, for example, the use of health information technology, medication reconciliation, as we already discussed for the brown bag, during admission or discharge, and also ensuring access to care after discharge and post-discharge follow-up. This is really important that the patient could reach out to the physicians and check if the instruction that they receive is really the current one. Another strategy to reduce medication error is to embrace technology. And for this, we need to use utility of technology because this have proved to have a positive impact on safety. We need to have well-designed system improving abilities in patient monitoring and surveillance. Also, because technology and innovation have played a major role in managing patient care and quality improvement. There is the Institute for Safe Medication Practice, and you have the links below, include a lot of tools there, including learning guides, manuals, and other materials that cover a variety of medication safety topics. For example, having a communication and collaboration platform could allow busy nurses, and we know how busy they are, to streamline many patient care duties, resulting in increased time for more personal interactions, such as patient and family engagement. Additionally, patients themselves could be more involved in the care with a specific tool as easy-to-read electronic whiteboards. So with that, I think that we are almost on time. I would like to draw some conclusion with you. So we know that medication error are a common problem that places a massive burden of healthcare system, and most importantly, are often avoidable by implementing effective preventive strategy. Lack of quality of healthcare is associated with communication problems, which at the end could result in a medication error. We should raise awareness of the need to improve patient safety in healthcare environment. And to do so, we should increase awareness in incorporating safety-related information into healthcare professional training. We need to develop communication skills. We know that if healthcare professionals have training on communication skills, we will have a positive influence in enhancing communication proficiency with our patients. We also need to request for improvement effort and system change of current medication error reporting system, because they should be targeted toward reduction in the likelihood to injury to future patients. And at the end, it's the responsibility of the organization to provide an environment to this user where reporting medication error is conducted in a systematic, ever-evolving manner, so that medication is prescribed using a safer infrastructure. Some take-home points. So reduce medication error require that the language used by healthcare provider is always appropriate, simple, and clear. We should also do the reconciliation at each patient encounter, because this offers a chance for the healthcare provider to correct any discrepancy or misinformation about medication management. Caregivers play an integral role in supporting the plan of care, and healthcare providers should engage with them and communicate adequately with all the team members. Effective communication between patient, caregiver, and healthcare provider during transition of care can positively impact on health outcome. And this was really demonstrated through several studies. Example of evidence-based strategy that the healthcare provider can employ for engaging patient and caregiver include the teach back method that we discussed and also the broken back medication reviews. To finalize, I want to provide this link for one activity that will be conducted also during this medication without harm initiative from WHO that will take place on 15th of September. And here you have the link, it's free of charge, and you could obtain more information about all the initiatives that I tried to explain before. With that, this is the list of reference, and this is all from my end. So thank you so much, and happy to take any question.
Thank you, Santiago, for your presentation. I have a question for you. You talk about the 5 moments and the 5 rights about medication errors. So how do you think patients and caregivers are realized about this, and how can we work with them in order to have more consciousness about this?
Thank you, Wada, for your question. I think that is really important that this information is distributed through media campaigns. Also, that healthcare provider could provide the availability of these resources, because it's important and it's a self-exercise that they should take care also time by time.
Okay, thank you. And another question that I have is, you talk about medication risk and all the transition of care from patients. How do you think that we can, again, work with the HCP and also to the caregivers in order to minimize these risks?
I think that one of the main or the most important point here is that institutions should implement an adequate transition of care. So, and this is something that sometimes didn't receive the importance that it have, and should have a process in place so all the need from patient are well addressed before patient is being taken to another institution. I think that this is the most important. For some institution could be different, but all of them should focus on that the patient or caregiver need to understand exactly which are the next steps that they need to follow, and also that they should receive a follow-up opportunity for check that the understanding and that the next step are clear enough for them.
Okay, thank you so much, Santiago, for your explanation. And well, keep with us with the next conference, and see you. Bye-bye to all of you. Thank you.
Thank you. Bye-bye.
Bye-bye.